computer. Awesome. Thank you everyone for watching or tuning in now. Um, welcome to, I'm Kelly Ransom, and welcome to my Public Health Hall for Progress. A quick note before we really begin. All panelists have been invited to speak to share their knowledge and experiences with the community. Their appearance does not indicate any support or endorsement of Kelly Ransom's campaign or candidacy. This is an information gathering effort for the community at large, and we thank everyone tonight for their time and sharing their knowledge and experience with us. So before we get into this, I just want to say I'm Kelly Ransom. I'm running for City Council in Boston for District 6, which is Jamaica Plain, West Roxbury, Rosendale, back of the hill, and a small portion of Roxbury. I've been doing these halls for about 2 weeks now, and we've been recording them and putting them on YouTube and sharing them to our audiences and for the public. And the reason that I decided to do Halls for Progress was to have a platform and a space for people with, different experiences in a certain field or different opinions on a certain topic to join together and talk with me. So I asked pretty neutral questions. And it's just for, it's a community benefit. I hope that it helps educate people more. So I'm not going to talk too much about myself. You can go to my website, kellyransom.com, if you want to learn more about me, because I want to spend as much time talking to our wonderful guests tonight as possible. So first up, before there's a slide. First up, we're going to talk to Toy Burton, who's the founder and executive director of Dee Dee's Cry and the Roxbury Unity Parade. And then we're going to talk with Mish Whitaker, who's a certified addictions registered nurse. And then we'll leave room for questions at the end. Real quick, I'm going to introduce Dee Dee.
Toy,
oh my God, sorry. You must get that a lot, right?
I do. I do.
I get it. I'm so sorry. I know that. One person show here. So my brain's in a million places. So Toy Burton is the founder and executive director of Dee Dee's Cry Suicide Prevention and Family Support. And Dee Dee's Cry is named after her sister, Danita Shane Morris, or Dee Dee. Toy started Dee Dee's Cry in 2017 after noticing organizations didn't have their events regarding mental health and suicide prevention in communities of color. Toy's organization, Dee Dee's Cry, creates space and events that elevate the conversation about mental health awareness and suicide prevention in communities of color. Toy Burton is also the founder, lots of hats, and executive director of the Roxbury Unity Parade. Toy started the Roxbury Unity Parade in 2018 after seeing other Boston neighborhoods have parades and celebrations for their community. Roxbury, once a predominantly Black neighborhood in Boston, the parade celebrates its culture and history. The Roxbury Unity Parade is a day of unity and celebration, and the Roxbury Unity Parade recognizes people, organizations, and businesses that uplift Roxbury every day. And just to point out some awards and recognition, because we always want to give more attention to things like that. On June 19th, 2018, Toy was awarded the Legacy in Time Award by Village in Progress, or VIP, which we will be talking more about tomorrow night at our Public Safety and Community Support Town Hall, Hall for Progress. Oh my gosh, I took too much NyQuil last night. And for her work in the community. On October 5th, 2018, she was recognized by the Boston City Council, organizing the inaugural Roxbury Unity Parade. So without further ado, I'm going to welcome Dee Dee. Oh my God, Toy! You guys, I've been sick for days and days and days and days. I did the first hall last night with the laryngitis, and I pointed out hey, I really promise that I have this, so you could watch the progression of it grow. But I've been taking medicine and I'm out of it, and I apologize. Toy.
I had $1 for every time someone made that mistake.
I can only imagine. But it's great. It's great marketing for Dee Dee's Cry, I guess, to get the name out there. So we kind of went over the mission and how you were started. So do you have anything to add to what I already said?
Yes. So my sister Dee Dee, she died by suicide when she was 23 in 1986. I also had my own suicide attempt when I was 25. And after she died, I started drinking heavily, got into drugs. I've been clean and sober for almost 23 years now. Yep, 23 years in August, God willing. But yeah, so when I started the organization, without a doubt, I was like, I have to keep her memory alive and name the organization after her.
Thank you for sharing that and being so open about it, because that's tough to talk about. So I appreciate that you shared that tonight. What does a typical, which I know with your two hats is probably never a typical day, but if you had to describe a typical day in your life, what does it look like?
Other than sending out emails and answering the phone calls, well, today was a good day. Today was the days that I love. So I met someone who reached out to me. She saw Dee Dee's Cry on the news last week. And she called and was like, I saw your story. I would like to meet you. And I do that. I meet with strangers who want to meet me. And yes. And so it was awesome talking to her and learning about her. And she promised and she's from New Hampshire. So I really appreciate her driving to Boston to come meet me. And so those are the days I love. It's not a typical day,
Yeah.
but yeah, I do meet strangers. No, that is a typical day, because even you reached out to me, said, hey, I saw you on Facebook. I like what you're doing. Can I meet with you? And I love that.
Hey, like I talk to strangers every day too, so I understand that is a typical day.
Yes.
Your day sounded amazing too. I love that. So why is mental health and suicide prevention, mental health care and suicide prevention essential specifically for communities of color?
So the reason why I started Dee Dee's Cry, so a friend of mine had saw on Facebook that I was posting about my sister, if she had lived, it would have been a birthday. And her brother had recently died by suicide. So, she's like inboxing me, like, it hurt so much. What could I have done? Just typical questions. And once we were done, I was like, let me see what's out there. And through Google, what I found is being on these websites, I did not feel welcome, right? I was like, I didn't see anybody who looked like me, where their events were being held. I'm like, okay, this isn't for somebody who lives in Roxbury. Like, why would we have to travel all the way to Framingham or Newton or Wellesley just to get this education? So me, I am a preschool teacher. It's not like I was like, yeah, I'm going to start my own organization. I want to do this. I felt compelled to do it. Because I was like, wait, people in Roxbury needs, mental health education and suicide prevention. And when I told my family, of course, it was like, Toy, you're not a clinician. How are you going to have a mental health organization? And I was like, okay, that's not what I'm trying to do. So what I did then, and now that we're coming out of the pandemic, can get back to, is connecting the families with the resources. So I'm like the middleman.
That's great.
Yes. So that's how I was like, I'm going to do this for communities of color. I'm like, they're not doing it. I'm going to do it.
And how do you do it? How do you connect folks?
So the first event was Dee Dee's Cry, Hot for Suicide Awareness, and Easter egg hunt, right? I was like, I'm going to have an Easter egg hunt in Franklin Park, and I'm going to have the resources there. So I went to like the health centers and was like, oh, I'm going to have, this Easter egg hunt. And if you could come and, bring your resources and let people know about your organization. I had 3 tables, only 3 tables showed up. Out of all the elected officials at the time, only Ayanna Presley showed up. She was like, she was city council at the time. And she was like, I don't get your connection between an Easter egg hop and suicide prevention, but I'll be there. And my thought with that is like, we love those who will go to a mental health fair, but I wanted to reach families who would bring their children to an Easter egg hop, and the resources are there. So there's no judgment. There's no going into a facility. You're surrounded by your loved ones. And you may not even know that you need this information. You just go into the table, you get in the pamphlet, and you might be like, oh, wow, this health center has that. I'm gonna sign up for, So hopefully, no, July 3rd, we're gonna have our first event since the pandemic, our first in-person event. So yes, so it's community with the resources there.
Do people call you too, or like reach out?
People call. We do have a weekly support group called Healing Begins With Me. We have the Dee Dee's Cry group on Facebook, which is more like just fun. I like to keep people like in a happy space, so it's very light. We do, because of the pandemic, we do virtual panels. And so our first event before the pandemic was Mental Health While Black. At that time, it was like everybody was like grilling while Black and, all this stuff. And I was like, you know what? We need mental health while Black. That's what we need, mental health while Black. And so we had our event in the bowling building in Nubian Square. And yes, and so many people registered, right? When I got the space and they was like, what size room do you need? I'm like, oh, less than 20. Right. And then once I put it on Eventbrite, like then 30 people registered, 60 people registered, 100 people registered. And I was like, oh my gosh, how am I going to feed all these people? I have on the flyer that, dinner will be served. I need to feed these people. And then I put it on Facebook and everybody just came to the rescue and donated food. And it was an awesome event. And then February 1st, we did the Grove Hall Library. And I was in the process of getting space for the Mattapan Library. And then the pandemic happened and we went virtual. So if you were to go to Dee Dee's Cry's YouTube page, like all our videos are there, or even just on the Facebook page under videos. So even last week we had a panel, Black Men in Mental Health. It was so awesome. It was neighborhood pastors, like 12th Baptist Church, St. John's Missionary Church, talking about men in mental health. And it was an awesome, awesome event.
Thank you for putting all these events together. Just because I'm curious as like a side event planner, have you noticed your engagement going up because everything's virtual now, or has there not been a difference?
No, definitely been a difference. So with the virtual, I don't have people do Eventbrite. I don't have people register. I feel like we're not trying to get your email address, it's on Facebook, press play when you want to. And I think that has been a blessing because, not everybody can tune in at that time, but yeah, we be having like over 1,200, 1,800 views, which we would never have, in person, so. And it's there. So even what we did last year is still there that you can go back and watch it. And so during the pandemic, like I'm a preschool teacher, and as a preschool teacher, I see children that I can look at them or know them and see that they may have a delay, right? Or something. And the parents don't know, right? Because as a teacher, we get this training to learn how to work with it, how to spot it, how to, do referrals for it. And I was like, parents should have this education. So Dee Dee's Cry, what I did, I recruited an old co-teacher of mine. And I was like, Crystal, I was like, I want you to, Saturday mornings, I want you to do a session for the parents to help support their child's social and emotional growth and development. Why do we have to wait for something to happen? Let's support them and teach them how to foster good social and emotional behaviors and stuff. And it was so awesome. But like I said, it's still there. Anybody could just go back and watch it. She talks about the red flags that you should notice, like if your child is not giving you eye contact, if loud noises bothers your child, just all the things you should look for and be aware of, and how to speak to the doctor to tell them what's wrong. And she had stuff for, teenagers and what type of parent are you, like different parenting styles and stuff. And like I said, people don't learn this. And that's what that was about, is teaching people how to be better parents, how to better support their children.
You sound like an amazing pivoter. Like you just like adapted immediately. You're like programming.
Yeah.
I love it. It's so great. And that's really important that you did that, because I am not a parent, but I've heard stories from other parents that, that education is needed sometimes in a home. So that's great that you provided that. What would you say might be the top or are the top 3 concerns that you hear from either like populations you work with or participants or just people, your neighbors?
Number one, definitely is there are not enough therapists of color, right? Everybody wants help. Most people want someone who can relate to their experiences. And so, men want to talk to other men. There's not enough men therapists, let alone Black men therapists. I would say number 2 is definitely funding. Before the pandemic, like Dee Dee's Cry was whatever I was putting towards it. And because of the pandemic, there were grants that I got, that I was able to give direct assistance, which Dee Dee's Cry wasn't doing before. So we was giving, $100 gift cards to families just to support them, through help of the Boston Resiliency Fund, the Boston Foundation, like all these amazing organizations that help the smaller organization help the community, so let me see. And number 3, I would just say as things are opening up, just where to go to get these resources and stuff. So even when I do bring a resource in, and they'll be like, wow, I didn't even know that was right there in Dorchester, didn't know that was in my backyard. So it's just connecting the people to the resources that they need.
I love it. And you do a great job at it.
Thank you.
So I know you mentioned a few places, but I'm going to put it in the description. So this is what I've been doing, because it'll be on YouTube. And like, you can click on the links to learn more down here. YouTuber, super cool. So where can we learn more or get involved? And I'll make sure that it's in the description of the video.
Okay, so you could always go to our website, deedescry.com, DEEDEESCRY.com. There is a donate button. You could definitely donate. There is instructions there if you would like to pay by check. If you would like to reach me, my email is didiscry@yahoo.com. You can follow Didi's Cry on Instagram. I'm on Twitter, but nobody follows me. Didi's Cry is also on Facebook at Didi's Cry. And the Roxbury Unity Parade, if you want to learn about that, that's coming up. Like I said, it's our neighborhood parade and celebration. It happens every third Sunday in July. It goes from Malcolm X Boulevard to Malcolm X Park. So you could go to the website, Roxbury Unity Parade, if you want to participate, be a sponsor, be a volunteer, all that good stuff.
You said it's on, I should know this. I should know this.
Yes.
I work, for everyone who doesn't know, I work in Nubian Square at Madison Park Development Corporation is my full-time job. So that's important for us to know the date. All right, the 18th, right?
Yes, July 18th.
Okay. Off the record, I will look into that for you
Oh, that would be awesome.
outside of campaign hours. Awesome. So I'm going to ask you before we let any of our guests, change agents, experts go, I like to ask, what drives you to do this work every day?
I just like for my community to have the resources that it needs to thrive. So like I said, I never set out to say, oh, I want a suicide prevention organization. I mean, I was fine being a preschool teacher, but because I felt like, okay, this is going on and my community is not getting it. And the same with the parade. I was like, wait a minute, other communities have these and mine don't. I just want my community to thrive like other communities. And so that's what keeps me going.
That's beautiful. And I hear you. I don't know. I'm so always like, you're so joyful to talk to and you do such incredible work. And I'm just so glad that you joined us tonight. And I'll make sure everyone gets all the information and exactly how to get to the donate button too.
Yes, thank you.
So thank you so much, Toy. Got it right.
Yes.
I had to think for a second. I was like, don't say Didi, don't say Didi. So thank you so much tonight for being here. Feel free to stay and take part in conversation afterwards, because we will leave room for questions. But next, I'm going to introduce, and I know her name because we went to high school together, Miss Whitaker. And she is I just don't want to get it wrong. A certified addictions registered nurse.
Yes.
I didn't want to get anything wrong. Usually I have staff like feeding me things throughout the thing, but solo tonight, solo candidate. It's all good. So welcome. Thank you for being here tonight.
Thank you for having me.
I know you're super busy. So
yeah, but this is like probably my favorite thing to talk about. So it was great to be here. And I just wanted to say, from having sat in, thank you, Toy, also for being here. I had no idea that organization existed, but I'm definitely going to look up Didi's Cry, and I think that's such important work, and I'm actually like a little nervous now to follow that, but thank you.
I love it. Yes, I love Toy. So what is your role where you work?
So I am a harm reduction nurse at Boston Healthcare for the Homeless program.
Love it. They actually taught me everything about what we're going to talk about tonight. But for those who don't know, what is harm reduction?
So harm reduction is most specifically used to describe a movement towards making risky behaviors less risky and reducing negative outcomes from behaviors that are otherwise going to occur, kind of no matter what. So it's most typically associated with drug and other substance use. But if we kind of expand that definition to just like reducing harm in everyday human behaviors that are more or less risky, we see examples everywhere, like seatbelts are harm reduction, right? We noticed that cars tend to get into accidents, and rather than ban cars, we installed safety features that make it less likely that you'll have a fatal or negative outcome from driving in your car. Sunscreen, condoms, those are all examples of harm reduction in action. Rather than restricting the behavior, we look to make it less negative.
I love that. You've just laid it out exactly so everyone will understand, I hope. So I asked Dee Dee, we've been asking kind of like everyone, what is a typical day for you?
So Healthcare for the Homeless is a pretty large organization, and my department is specifically the harm reduction team. And we actually operate out of 3 unique physical locations. So depending on where I am for the day, it might look like being indoors at like a low threshold drop-in harm reduction center, or it could look like walking the streets and doing like outreach, like physically out on the sidewalks. But basically, any typical day would include things like wound care, doing assessments of whether folks need a higher level of care for something going on. So maybe it's somebody who doesn't feel comfortable accessing a hospital or accessing an urgent care center for whatever reason, but they just really want you to look at this bump or like look in their ear because, right? So we're doing that kind of thing and telling them whether it's something they definitely should be going to the ER for or whether they can take care of it on the street. Overdose response, overdose prevention, education around how to make risky behaviors safer, and then handing out supplies like clean syringes, alcohol pads, condoms, things that help people to stay safer on the street. And then also doing referrals to detox programs, inpatient substance use programs, and things like that that otherwise they may not have access to.
Thank you. You are doing incredible work. I'm just curious, what size is your team?
Our harm reduction department consists of 4 harm reduction specialists who are case managers by trade.
Cool.
And then 7, I think, registered nurses, including myself, although not everyone is full-time. We actually only have 2 or 3 nurses that are 40 hours a week, and everyone else is kind of just filling in hours. And our team also collaborates really closely with the HIV team at Healthcare for the Homeless, which is kind of their own department. But they have outreach case managers, outreach nurses, and they also have this new role this year. And we were actually just featured in an article, which I can include at the end for resources. They're called PrEP champions.
Oh,
And their job is to not only create access to PrEP for people who are unhoused, but to aid in compliancy. So another one of our roles, along with the PrEP champions, is to enroll people on PrEP and then the nurses will store medications for folks, which is not just PrEP, it's also like cardiac meds or insulin, because otherwise people lose it or their bags get stolen or thrown out in street sweeps. And so we can actually store their medications. They can come find us every morning and get their meds. And it has enhanced compliancy. There's a research paper that just came out about compliancy numbers for people who are unhoused on PrEP to prevent the spread of HIV in homeless populations between people who use drugs. And it's incredible work with a lot of moving parts, but those prep champions are insane, and they're not clinicians. They're case sometimes they're case managers, sometimes they're just volunteers like AmeriCorps, and they're just an incredible group of people that goes through great lengths, all weather, all days of the week to just get people their meds.
That's incredible, because I know that there's, you know, an increased rate of HIV right now.
Yeah.
And I've been paying attention to it because I lost my uncle to AIDS when I was younger. So like, I've always kind of kept paid attention to what was going on with like HIV and AIDS. And if anyone notices that I'm smiling and we're talking about really serious stuff, it's because I'm so happy that this work is happening. I'm not like happy that these people are in these situations unless they choose to be. But I'm happy that this work is being done. And
same. I'm literally sitting here gleeful, and I think that could be spreading the wrong message, but I'm just excited to be in it and walking these paths for people.
So I'm gonna dive in to what we're really, I mean, I just want to talk to you anyway, but
I know. I could do this all night though, so you have to like rein me in.
What is a safe consumption site?
Okay, so I'm going to try to make it like a nice, normal, short answer for people. A safe, or sometimes we refer to it as a safer consumption site or a supervised consumption site, just to kind of acknowledge that there's always inherent risk, right? So we're trying to make things safer, but it's not necessarily like everything's fine. So a safer or supervised consumption site is a designated and sanctioned space where folks can bring substances that they've already obtained. So it's not a place where you can obtain substances, and they can use those substances in the space under the supervision of supportive and trained staff who can assist them to have non-fatal outcomes, and also to enhance the safe practices and educate people about that, or to connect them to mental health services or substance use and treatment services if that's what they would like to do.
That's awesome. One, I know I made a note of changing my language because that makes sense to me. And yes.
Yeah.
And two, random, but are housing resources?
They can be.
Too?
Yeah. I know that there is, so there's a safer consumption site in Vancouver called Insight. And I believe they have housing services. There's safe consumption sites in, I think 120, 60, and there's like over 100 sites, so maybe 120 sites, and they're in like 67 cities all over the world. None of them are in the United States. So I don't know a ton about whether housing is a part of what is being offered, because some of them exist in countries where housing is actually probably not as much of a problem as it is a crisis here in the United States. For example, they have them in Norway, which I don't think that housing is as much of an issue there in smaller countries as it is here.
I'm just thinking because I don't understand why we don't have them yet, but we'll find out someday.
Yeah.
Mostly
stigma.
What's stigma?
So there's actually something interesting is there's a lot of movement to try to have them here in the United States. There's a nonprofit in Philadelphia, for example, that was in the news recently. People may remember, they're called Safe House, and they're trying to position themselves to be the first supervised consumption site in the United States. But they were sued by the Trump administration. and the appeal went to like a federal court, and it was shut down. I think the vote was, it was very close, but it was shut down, and that was just in January 2021. So they're going back to the drawing board, and they're going to continue to work on it. But a lot of it is what we've all kind of like been told or taught about substances, and what substances are good versus bad. And I think that stigma is just going to be really hard to shake for a lot of people.
I hope that, I don't know, I'm for at least decriminalizing. And if you're gonna do harm reduction or laws or anything, like I feel that for all drugs to be treated equally, kind of.
Yeah. I mean, when people ask me, like, what would that even look like? Like, what does a safe consumption site look like?
Yeah.
A really good answer is like, well, it's like a bar if you could bring your own alcohol, right? So alcohol, although there is some stigma still, especially around addiction to using alcohol, we freely talk about getting drunk on the weekend, and it's like, it's kind of all over our culture, and it's very normalized, and bars exist, and you can go there, and the bartender is trained to know when to cut you off, and it's kind of in a way, it is a supervised consumption site for one specific drug that we as a country have decided is like on the good list.
That's a great example. But also marijuana. Like I know that
yes,
there's spaces, at least in Colorado, I'm sure there's more,
yep,
where they're coming, where people can just go and enjoy marijuana in a safer space, I guess.
yes, exactly.
I'm gonna just say real quick, like when I learned about supervised consumption sites, I was working at city council and I hadn't heard of them before. And Boston Healthcare for the Homeless, like so like graciously and genuinely opened their arms and was like, we'll teach you all about them. And I got the honor of like being able to go to a book. A person wrote a book. I want to say it was about Vancouver.
Fighting for space.
Fighting for space.
What's his name? You
I'm
have it
trying to
written
find
down.
it right now.
I have to Google it. It's a really good book. That was going to be one of my resources if people want to know more about this.
Yes. Oh, where are you? Travis Lupick.
Yes.
So I got to meet him. I got the book. I read the book. I passed the book on to other people. And what was really cool there was they had a mock supervised consumption site that you could walk through. And I found it really illuminating to be like, oh, this makes sense. Like,
so the
American small.
Yeah. The American Medical Association has actually released a statement, which was really powerful because to be endorsed by such a major organization that's so well respected for their medical opinion. I'm just going to read the quote because otherwise I'll mess it up. But it's that studies from other countries have shown that supervised injection facilities, and they use injection there, and I'm actually going to talk a little bit about my problem with that later, reduce the number of overdose deaths, reduce transmission rates of infections and infectious diseases, increase the number of individuals initiating treatment for substance use disorders without increasing drug trafficking or crime in the areas where the facilities are located. So all of these studies have shown that the effects on the communities where these facilities are located is like a net positive for the users and also their neighbors.
So I remember when they were just referred to as safe injection sites. And then I remember that changing.
Yes.
And now it's changed again, which I love watching the evolution of it, but like the language keeps getting better.
Yeah. I love it. The more we learn, the more, and it's been really humbling because I didn't set out to do this work either. And I was just working with healthcare for the homeless. I've actually been there for almost 15 years. It'll be 15 years next year. And it was kind of, if you ever heard the quote, like the next right thing. And it was just like learning, even in such a vulnerable population, when you just think of like people who are homeless or people experiencing homelessness, you know, the first thing you think of is, wow, like those people are, you know, facing a lot of stigma, and they're vulnerable. And but even within that community, like there are other like categories of people, right? Because of course, like people without homes are just, it's the same demographics as everybody with homes. Like, so you have people of color, and you have women, and you have people who are trans, and you have people who use drugs, and then you have combinations and intersection of all of those things. And so it's just been really illuminating to like step by step down the path to like, what is the most vulnerable pocket I could be working with. And
Thank
this
you.
is it for now, today.
That's, I'm so happy that you're doing this work. Just one thing, what you said, you don't necessarily like the safe injection site. I just
Mhm.
want to,
Yeah, so this was it's not equitable, and that's something that uh I will come up with the title of this other book, and it's written by a pioneer of the harm reduction community. She's a Black woman who is also a clinician, and it's just it was just like it just like unlocked, you know, like every door. But I'm obviously not the first person on my team to have had this reaction. But
Mm.
essentially, um, when we talk about the war on drugs and how it has affected people who use drugs, it has disproportionately affected Black and Hispanic individuals and their families and their neighborhoods. And the harm of that is not over, and the wounds of that are not healed. And so for people to rally around harm reduction in this way that like really emphasizes or glorifies like the opiate epidemic specifically, or injection specifically, like really does a lot to perpetuate that harm for individuals who don't inject and who aren't using opiates. They are smoking, and they're using stimulants. And there are, if you look at the numbers, the demographics of people that choose stimulants, specifically crack or meth, as their drug of choice, and who choose inhaling or smoking over injecting, those individuals tend to be people of color. And so when we look at harm reduction through that very small lens of like the opiate epidemic, like we tend to see a lot of like white kids from the suburbs, and like they need help too, but it's literally like, whoa, you ignored the 80s, like you ignored the crack epidemic. There are still people in prison, there are people in graves, and there are people suffering right now. So if we're talking harm reduction and you're giving out needles but not pipes, and you're building injection facilities but not consumption spaces, then your work, it's perpetuating harm rather than reducing harm. So
thank you. That was a great explanation. I could talk about this for hours, but I'm going to move along. What are the top 3 concerns that you hear from the populations that you work with? Because you, like you said, you work with
Yeah.
so many different.
So that's one of them, and like that's huge, right? So for my patients who don't fall into the category of like, I started experimenting with oxycodone from my mom's like bathroom cabinet, like they don't feel like they have spaces, they don't always feel welcomed in harm reduction spaces. They might be amped, which is a very different vibe than being sedated. So one of the spaces I work with at Healthcare for the Homeless is called The Spot, and it's a room with 6 chairs, and you can come in there if you feel like you're worried that you might OD. You can drop off a friend there if you're worried they might OD, and nurses will monitor them and take their vital signs. And it's really quiet space usually, and people are sleeping. But if you're coming in on it, and the demographics like vary like greatly, but we talk a lot about like making the space itself feel safe. And if you walk in there and all the nurses on that day are white and the participants are white, like how are you going to feel safe if you're not? And the same is true for like, you know, we have women come in on a day where it's a lot of men using the space, and like that might not feel safe. So there's a lot to like kind of unpack there, and a big concern from my patients, no matter kind of like what their intersectionality is like, where do I fit in, and how are you going to make spaces that feel safe and welcoming for me? And I think that's really important to address as we like move forward and build more spaces. The next is probably that stigma kills more than drugs do.
Mhm.
And that's like a loaded statement for people, especially all of us who grew up on DARE and like, you know, just drugs are bad and you can die the first time you do certain drugs. But a lot of what actually kills people is lack of access to services, lack of feeling safe, even asking for services, and no spaces. And not to harp on that safe consumption site idea, but you know, if you have to decide between like getting unsick, because for a lot of people they're not even getting high, like when you have an addiction and you are in withdrawal from that substance, you're in pain and you feel very unwell. So for a lot of people, dosing themselves at this point is actually just like staying level.
Yeah.
They're not even doing it to get to anything other than that. And so if they have to like do that like behind a parked car like super quickly before the police find them, or somebody gets mad at them, yeah, they're going to drop the needle on the ground, which is bad for communities. Yeah, they're going to do a shot that's too much, and they're not going to test their dose first because they're in a hurry. And that's the stuff that kills people, right? Like it's stepping on the discarded needle, or it's using a shot that was like unsafe because someone added something to it that you didn't expect. And so it's the stigma that's preventing these like safer spaces from being open that actually leads to the fatal events, and not actually the use itself in probably like 90% of cases, you know. And so that's a huge one that my patients would love people to know. And then the third thing is just that they're people, you know, like they're people. None of them picked up because they were feeling great about their lives. There's a story behind every decision to use. And the fact that, I mean, and Toy spoke to this too, actually, like the lack of mental health services, especially in certain communities, right? We talked about, Toy was talking about like the Black community, but there's so much in the way in terms of like why people don't seek treatment. And then when they do, how they're treated. Like often people, their stigma is coming from their family or their neighbors, but it also comes from the ER staff, and it comes from the police, and it comes from the people that are kind of supposed to be there in a protective and supportive role. And so if you can't turn to those people, then you just stop turning to people. And so I guess my patients just want you to know that like they are all people, and they're worthy of love, even if they at some point in their life didn't know that they were worthy of love.
That is really important to remind people of. Like, I come from a long line of substance use disorder in my family. So I've experienced that firsthand. And then I've experienced homelessness twice. So I've experienced that firsthand. So like, I don't understand, you know, being a drug user. Is that the appropriate way to?
Yeah, people who use drugs.
Yeah, people who use drugs. So I can't relate to that portion, but I've seen it happen in my life. So
Yeah.
I don't know. It just like all clicked for me when I learned about supervised consumption sites, like, and how, and you know, stigma is such a big one too. Like, I'm in a white cis Irish Catholic Boston family, and like I did not get mental health until I like completely broke mental health services or therapy until I completely broke down, because my family was always like, you know. And now I'm advocating for them to do it too.
Yeah. I mean, we have really similar family backgrounds, and the idea of you just like, you know, you just keep going. You just put your head down and you just keep going. And I mean, for both women, but especially like the men in my family, like there's no way they would ever go to therapy. There's no way they would ever have sought those services. And that's what kills people, you know?
Yeah. Well, like, I'm not perpetuating this behavior at all, but like, I've noticed with my family, the response to potentially dealing with their mental health crisis is drinking alcohol.
Yes.
And that's kind of more pushed on. It's been around me more than like mental and behavioral health has ever been talked about in my family.
Right.
Like, I've met a lot of people like before the campaign and during the campaign trail who share similar stories. So like, I can only imagine, I can't what it's like for other communities that aren't white and cis and
Mhm.
from
Yeah.
Boston.
Yeah.
Like, so those are really good to point out.
Yeah.
Do you have anything else to add?
I could do this all night. We stop there.
Maybe
For
I
now.
should just meet up for coffee just to like
Yeah.
talk. Oh, well, I'm gonna be shadowing you.
Yes, Kelly is coming to shadow the outreach work that I do in July, and I am so excited.
I am too.
When?
The 12th.
Yeah.
We in Vegas.
Well, if you ever want to come down, Dee Dee, actually,
Toy.
Toy. Oh my gosh, I made fun of Kelly in my head for doing that.
I know.
I literally was sitting here like, Kelly gotta get her shit together. Can I? Oh no, I just said to ask for it on your very professional.
I have a restaurant round table with a bunch of cooks and bartenders, and they were just flying, and I just let it happen.
Understood. Toy, you and I should talk offline if you like. I think that my patients need referrals to Dee Dee's Cry. So.
Definitely get my contact from Kelly.
Yes, thank you.
Hey, this is like what it's all about.
Love it.
People together. So where can we learn more or get involved? And I'll make sure that it's down here
In the link section.
on YouTube.
If you're interested in just more about harm reduction in general, harmreduction.org is a great resource and place to start. If you are already totally on board with harm reduction and you're ready to move on to we should have safer consumption sites, and you want to act locally, there's a great organization here in Massachusetts. They have actually been around long enough that injection is in their name, although that is not the only thing they now advocate for. They just didn't want to change their whole brand. Yeah. And they are called SIF, SIF, MA for Massachusetts now. SIFMA now, and they have sifmanow.org where you can learn more about registering for events, donating to their cause, or just signing petitions and showing up for city council meetings to talk about why safer use sites would save lives and save money in our community. And you can follow me on Instagram. I'm at Harm Reduction Nurse, and my content is all geared towards people who may be just dipping their toes into harm reduction, maybe don't know if they're into it or not, and so it's one of the like more gateway into radicalizing your drug policy views accounts. So
I love it. That's great. And I'll put I'll put all that. And I'll put the book that we talked about earlier. Did you say there was another one?
Yes, and
you can email it.
I'll email it to you because that's really important, because she is one of the like founding people talking about harm reduction, and so I want to get that out there too.
Awesome. Make sure to do that. So we ask everyone, you saw Toy, what drives you to do this work every day? So
I had mentioned earlier, I didn't set out to do this, kind of like Toy. It just kind of, you just kind of keep following like the path, and then suddenly you have this whole like Instagram account. But essentially, one was creating something that I didn't see growing up, and recognizing my own privilege in the spaces I was in. So like, I think a lot of like white Boston. I mean, we didn't live in the suburbs. We lived in West Roxbury, but that might as well be the suburbs. You know what I mean? And my mom would let my brother and his friends drink and smoke cigarettes in the backyard because she thought that was better than them doing it like on a street corner or in the woods, like in the quarry, because she could be there if something bad happened. And I went to parties where that was also the norm, like where like there'd be a parent home, but they were just like pretending nothing was happening. But if there was an emergency, which there was one at a party I went to, this girl definitely overdrank. She was throwing up. It was like really scary. I wasn't a drinker in high school, so I was like totally sober and went to the basement and like got the guy's mom, like, and we took care of it in a way that a bunch of like drunk teenagers like wouldn't have been able to necessarily do. And so that experience like left a big mark on me because the folks that aren't around anymore from my teenage years and my college years are the people whose parents weren't able to do things like that because they either were too busy working like jobs that required like option, like weekend time, like shifts like at night or on weekends. Like they didn't have 9 to 5 like lawyer jobs or whatever that kid's mom did. They didn't, you know, or because the communities they were in, it would have been really bad for them if the police had been called. Like police were called to parties in West Roxbury and like nothing happened. And
All
we
the
know what
time.
happens when police are called to other neighborhoods. And so like for me, this work is also just about like, why can't everyone have that experience of like knowing that they're so loved that people want to keep them safe? Like that, you know, it's just so frustrating from a societal like
Yeah.
level. And then the answer that I never share with people, and I don't know why I feel like sharing it right now, is also that I'm religious. Like I was raised Catholic. I've explored a lot of different kind of Christian paths the older I've gotten. And I think a lot of people use their faith as a weapon. And it's actually, I don't disclose my faith a lot at work in the interest of harm reduction sometimes, because some people have been harmed so badly by religious institutions that by me aligning with them, that could be violence, you know. But for me personally, because I feel like the basic message of Christianity, of the Judeo-Christian like faith in general, is like preserve life and like love without reservation. Like what is more that than doing this work? I think harm reduction, I'm not the first person to say this, but there's a quote in harm reduction that harm reduction is just radical love. And I think that it just aligns so closely with my beliefs that it's really important to do that. And I'm sharing that only because I think a lot of people who are religious like use a religion as a reason to shut out their friends or family who have problems with substance use, because it doesn't line up morally with like whatever they may think is right and wrong, and you have to be clean, you have to be sober. But if we're really talking about, to me, like who God is inviting to the table, it was everyone, and there was actually like no parentheses on that, right? It was just like not everyone except, it was like everyone. So
Thank you for sharing that. I really appreciate it. And I agree about the religious thing. Like I grew up in a religious family. I am no longer involved in religion. I do have like, I'm still spiritual. I still have faith and stuff, but it's because I had a negative experience, you know, like
yeah.
not even close to some other people's experiences, but it was not great. And I appreciate you disclosing that. Because honestly, too, you're like, there's a stigma around religion too, but we won't even get into that. But
we don't have time. But yeah, I mean,
we're already
on two
time.
sides, right? Like one is like, how could you be so dumb as to believe in like a sky monster? And then the other is like what I said, like I say I'm this, and I'm suddenly putting myself in a box that might like very much be violence for some people. And that's not what I like that. Anyway, so
Thank
It's
you.
hard.
I'm thankful for you being here tonight. I'm thankful for the work that you do. I can't wait to see you in person and shadow you.
Yay.
And I'm just so grateful that this work is being done, because I'm one of those people who wants to like help all the things and do all the things. Like, this is a field that I'm definitely interested in, but I have no space, like I have no right to be in. Like, I'm not a nurse or anything like that, but it's always comforting to know that there are other,
And I'm not a clinician, and I'm in mental health.
Right?
I mean,
Toy
yeah,
started a whole organization.
I'm trying a different way. I'm trying to make policies and
She's
like,
also, I'm making assumptions here, but she's not like a marching band director, and she runs a parade. So I feel like
Exactly. I Googled it. I was like, how do you run a parade?
it's not easy. It's a lot of work.
I
Like,
can't even imagine. I have a hard time getting people to show up for a meeting, like a
Me
parade.
too.
It's insane, Toy.
everyone loves a parade. Like, and Roxbury turns out like we had a block party with Black Market last weekend.
Yeah, that was awesome.
We meaning the organization I work for, Madison Park Development Corporation. I only touch on them when I have to. Normally they're separate, completely separate lives. But we held this awesome event with Black Market in Nubian Square. And it was just celebrating Black artists, Black businesses, Black restaurants, culture, history. And there were so many people there. So
That's
like,
awesome.
it's always going to be even bigger for the parade. Like, everyone wants to get out and celebrate Roxbury. People who live in Roxbury are like very proud to be from there, live there. So the parade need is important. I'm so glad that you did that too. Even though it's not related to like the mental health and stuff that we were talking about. It actually
But
is though,
it
because
is, right?
it's visibility. Like,
Mhm.
so I'm not telling Toy anything she doesn't already know.
Still good to hear it though.
I want to open the floor for anyone with questions before we sign off. I have put all of my information in the chat, and we put this down here on the YouTube. There is a Google form that we have where you can submit your ideas for progress if you are unable to make an event or you want to submit anonymously. And then the website and the policy platform, which is still growing. Opportunity to volunteer, blah, 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 blah. But any questions before we close out tonight?
No, I just want to say thank you to Blue Cross Blue Shield of Massachusetts. Dee Dee's Cry just received a grant from them. And anybody who ever, thank you to you, Kelly, for donating to Dee Dee's Cry, because without that, I could not do the work. So I appreciate everyone, yes.
And everyone I mean, I can't speak for everyone, but I believe that everyone appreciates you. I certainly do. The work that you do is life-saving, truly. All right, everyone, then I'm gonna close it out for tonight. You can totally get in touch with me if you have thoughts, opinions, anything you want to share about the conversation that happened, whether you're watching now or later. And this will be on YouTube hopefully by tomorrow. So good night, everyone.
Bye, Kelly.
Good
Thank
night.
you.
Yes, good night. Nice meeting you.
Nice to meet you too.